Hello everyone, welcome to MSK Ultrasound Shorts, second in the series of swollen forearm, let's ultrasound it. A 55-year-old male presented with complaints of lump over the volar aspect of right wrist and distal forearm since last few months. However, his present complaints were painful restricted movements of right hand and fingers since last few days, so he was unable to drive his scooter. He was also a known case of rheumatoid arthritis since last 10 years. And this is the high resolution ultrasound image of the volar aspect of right wrist. We can see a well-defined cystic lesion, which is a thick-walled cystic lesion with multiple internal echoes within. It is located superficial to the digital flexor tendons, and median nerve is seen running immediately lateral to it, however no direct compression was seen over the nerve. On going further distally, what we could find was there was a communication of this cyst with another similar thick-walled cystic lesion which was located deep to the flexor carpi ulnaris tendon. Now the most important point was this second extension was not seen physically. On going further distally into the carpal tunnel, this cyst was insinuating between the flexor tendons with resultant increase in carpal tunnel volume and mild compression over the median nerve. And now see the USG images of right palm. What we can see is a big large cystic lesion, in fact a large fluid-filled sac with flexor tendons of right third, fourth and fifth digits floating within this sac. This is a panoramic ultrasound image of distal forearm, wrist and palm, and we can see nicely the extension of the lesion in the hand going through the carpal tunnel and then in the flexor aspect of wrist. So these are the flexor tendons which are seen within this entire oblong shaped cystic lesion. So the diagnosis was compound Palmar ganglion, and the surgical findings exactly matched with the extension seen on ultrasound. So the ultrasound could provide the roadmap for surgery, and more importantly, what I said, there was a small extension of this cystic lesion deep to the FCU tendon. On surgical exploration, this extension was not directly seen. If the surgeon wouldn't have been knowing that there was an extension deep down, then it would have resulted in partial removal of this cyst. But since the surgeon was already knowing there was extension deep to the FCU tendon, he further explored and dissected deep, and there was quite a reasonable portion of the cyst which was located deep to the FCU tendon. So on the basis of ultrasound, we could diagnose what was the lesion. It was a ganglion cyst. Which type? It was compound Palmar ganglion. And what location? Ultrasound could beautifully delineate the entire extent of the lesion in the wrist, with two components lying over the long flexor tendons and another component deep to the flexor carpi ulnaris tendon, then extending into the carpal tunnel and further into the palm, encircling the flexor tendons. So this was the compound ganglion, Palmar ganglion. Thank you.